Hi everyone, I'm Dr. Lila Abbate and I'm a physical therapist, and welcome back to my YouTube channel. Today we're going to be talking about a topic called erectile dysfunction for men. As a physical therapist dealing in muscle and nerve function, I'm evaluating the strength of some of the male pelvic floor muscles in order to have a male sustain an erection and to complete orgasm. So the power of those muscles or the strength of those muscles are the topic today. Two specific muscles that we're going to talk about is the ischiocavernous and the bulbospongiosum. So those specific muscles, which have very long names, really keep blood within the shaft of the penis and create the rigidness that it has. So if you're noticing that you don't have any other cardiac implications or testosterone issues and you potentially need to be medically cleared by your physician, and that's complete, and now you're still wondering why maybe your penis is not as rigid as it could be, you may have muscle weakness or a muscle problem. So then that's when you would come to a pelvic health physical therapist. We can evaluate those muscles, determine its strength, determine the length, because muscles need normalized length in order to function appropriately, and then that gives us information on what we need to treat. So those specific muscles create power, even for ejaculation. And what's interesting is that when we talk about women who become infertile in a male-female partnered couple relationship, then we're thinking about the projection of the sperm once it leaves the penis. There has to be some kind of level of passion and or power to the semen and how it can then be pushed or entered near that edge of the uterus, so that the uterus can then pull semen into the vaginal area. And if a male has muscles that are too tight and that they don't have good contractile strength because they are too tight and too rigid, then the sperm, once it leaves, it sometimes just kind of drops off. So instead of having a power where it can create length, maybe 3 inches or so, I don't know the true normal values of that, but nonetheless there has to be power. And if you're just seeing that your sperm on ejaculation then just starts to dribble and you're in a couple relationship and trying to become pregnant, you can maybe realize that your muscles can be too tight, creating some of this infertility. So here within physical therapy we can also work on the opposite, muscles that are too weak. So when they're too weak, you're going to be coming in and assessing how the strength of the muscles are. And when that happens, we need to work on strengthening. So in one of my other video clips, I talked about a home biofeedback unit for the pelvic floor. And then this is a rectal sensor. I talked about this in the fecal incontinence episode. And so then men can use this to help them strengthen. And then this is a way that they can exercise at home. Again, you're coming in for evaluation with the physical therapist. We're assessing your muscles. We're determining if they're weak. And then if they are weak, we can set you up with some type of home pelvic floor unit in order to help you strengthen. So I hope that was some little information today and some tidbits on some causes of a muscle dysfunction creating erectile dysfunction.